Years and years ago, I ended up with a couple of what's, I guess, referred to as minor hernias. And actually, I was looking at being pretty restricted in my lifetime if I had not been able to have it done. And in doing that process, I got to talk, of course, to a lot of the doctors and associate personnel. And they pretty well informed me that if I went to any kind of stuff like this for anybody else other than Dr. Muffoletto, I was asking for trouble. And from multiple sources, everybody gave me Dr. Muffoletto's name.
My name is John Muffoletto, general surgeon living in Anchorage, Alaska for 28 years now. Becoming a caregiver, a doctor, or a surgeon, I think starts with service. As a general surgeon, that name implies knowing your entire patient. It's general surgery. There are not that many fields that you really need to feel comfortable taking care of your patient from start to end. In the world of subspecialties, you rarely get to do that, but in my training, I did, and I found that very rewarding.
I've never met anybody in the doctor line that was that forthcoming on what was going to happen, how it was going to go. He's very knowledgeable. He's very verbal about what's going on and what's going to happen. He has a very confident, calm, easy approach, easy to talk to. It's been nothing but great. No problems at all. Very impressed all around.
Now you have someone's quality of life that is severely affected, and you can see that the second they walk into the office. They're withdrawn, they're depressed, they don't know where else to go. And they can be walking with canes, they're on narcotics, chronic pain. I mean, it is life limiting. And you take them through a very brief process of how can this person now trust me when they've had 3 previous or 4 previous failures? What am I going to do different? Who am I? So when I gain their trust, and then I do my advanced technique, either it be robotic or whatever it is that I'm doing, to solve their problem, and then 1 month later, they're completely transformed. So they have their life back, and I get to see that. So I think that is probably one of the most rewarding things that you can have as a surgeon, that you've actually fixed something and they're happy about it.
When you're going in, you know exactly what's going to be happening, how it's going to go, and what to expect after it. And boy, you can't ask for much more than that.